hello, Dixie.
You're fine. Do you ever feel extremely fatigued, have increased thirst, increased urinary frequency, or blurry vision? These are the 4 most common symptoms that diabetics come in with when you come into the hospital. Working as a registered nurse, I see a lot of these diabetics come in and it's the same symptoms every time. Today I would like to inform you about type 2 diabetes, what it is, foods you should avoid and you can eat, and then how to manage them. So what is diabetes? It's a disease affecting how your body produces insulin and how it uses that sugar. Sugar is also known as glucose. And insulin is a hormone that helps the body use sugar by allowing it to enter the body's cells. In diabetes, your body has trouble using this insulin or is not making an adequate amount of insulin. According to the American Diabetes Association, contributing risk factors of diabetes include a family history, consistently high blood sugars, high blood pressure, high cholesterol, obesity, race, and one that I didn't include up here is if you've already had gestational diabetes. Symptoms from diabetes are not limited to these, but they're usually increased thirst, increased urination, increased hunger, weight loss, fatigue, blurry vision, slow healing sores, and frequent infections. Now that you know a little bit about what diabetes is and the symptoms, we'll talk about the foods. According to Andrea Hoffman, which is an endocrinologist at UPMC, she likes to tell patients to limit their carbohydrates for meals to 15 grams. She has pamphlets that she hands out to patients, and it's a really good resource in order to track what food you want to have for lunch, dinner, anything like that. Up here, carbohydrates are found in starches such as beans, bread, cereal, starchy vegetables, fruits, milks, and sweet. You just want to choose foods that are low in fat and cholesterol. Choose lean cuts of meat, fish, skinless poultry. Good source of fibers, which can be vegetables and whole grains. Now that you know how to manage the diabetes with food, between the 15 grams of carbohydrates for each meal and the foods you should avoid and foods you can have, management of diabetes. Diet is the #1 thing that you want to control. If you control your diet, you won't have to take as many medications. Medications that diabetics are typically on are metformin, which you can be on it once a day or twice daily, or insulin. There's multiple insulins that you can be on. There's a fast-acting, which you take before each meal, and there's a long-acting that people either take in the morning or at morning and bedtime or just at bedtime. In order to control your sugars, you want to be taking your sugars before each meal at least, which is before breakfast, lunch, and dinner, and then also at bedtime. This is how you can tell how much insulin to give yourself before going to bed. Another big thing is the hemoglobin A1C test. Andrea Hoffman always gets an A1C when patients come into the hospital because an A1C measures your compliance of controlling your sugars in a span of 3 months. And when you get your A1C checked, depending on what that level is, we'll have them change your medication. So either you'll go on metformin more often, a stronger dose, or your insulin will get changed around. The last thing you want to do is exercise. Exercise can also help lower your blood sugar by lowering your blood pressure and keeping you within a healthy weight. Controlling your weight will help you manage your diabetes. lastly, diabetes can be a dangerous disease if your sugars are not well controlled. You can go into the hospital and can mess everything up. Second thing is long-term effects. It can damage your kidneys. A lot of patients that have diabetes usually have kidney disease and end up on dialysis.
Whoops.
On top of not having controlled sugars, it also damages your eyes. A lot of people lose their vision within time. It also destroys your nerves, your veins, and your arteries. Typically, they will come in and you'll have sores on your feet because you lose feeling. That's called diabetic neuropathy, and most patients have to go on more medication to control those nerve pains. You want to continue to manage with medications. You want to exercise, have a good diet. And now that you know the basics of diabetes, hopefully you can manage it better. For more information, I do have packets and papers about A1C I gave you already. And you can also go on to the American Diabetes Association for more information.